During a site visit on Friday at the National Care and Treatment Center located at Thomas Street, Georgetown, Sarah Ann Lynch, United States Ambassador to Guyana, noted that while Guyana has made significant strides in achieving the first target of the UNAIDS HIV 1990 goal by ensuring that more than 90% of the people living with HIV in Guyana know their status, urgent steps are needed to ensure that the various levels of treatment are enhanced and the needs of the vulnerable population are met.
Of every 4 individuals diagnosed, only 3 are on treatment. And this is not enough, and lives are at stake. Therefore, our priority must be to increase treatment coverage, aiming to ensure that everyone diagnosed with HIV/AIDS is immediately linked to life-saving treatment services. We believe strongly that services must be client-centered, meeting individuals where they are with what they need. Our PEPFAR support will help strengthen this, including for the most vulnerable populations.
Guyana has received in excess of $185 million through the PEPFAR mechanism since 2004 to support HIV prevention, testing, care, and treatment services. The funding will support initiatives by the Ministry of Health and civil society partners until September 2022. Health Minister Dr. Frank Anthony highlighted that during the years of partnership with PEPFAR, voluntary testing was introduced locally and treatment services were decentralized. A number of physicians, he added, were also trained to support the effort. He highlighted that the ministry will be launching 2 new initiatives to encourage persons to continue testing as well as to reduce transmission.
And one of the things that we have introduced is self-testing. And we have developed a strategy of introducing self-testing. And so we want to roll that out. We are going to do more work on that to roll that out. But this is going to ensure that we get more people to test and to know their status.
Access to the pre-exposure prophylaxis PrEP for those who need it will also be provided.
Before, this was quite limited to serodiscordant couples. So we want to now make sure that anyone who feel that they are at risk, they can come into any one of our clinics and get PrEP.
Further, the dried blood spot testing methodology will be introduced at the National Care and Treatment Center to detect mother-to-child transmission of the disease. There's approximately 8,752 persons currently living with HIV in Guyana. 71% of them are receiving sustained treatment, while the viral suppression rate stands at 69%. Temika Rodney reporting for the HGP Nightly News.